Welcome everyone. Hope you're all doing well, and welcome to the August 3rd edition of the COVID-19 update, which has drifted into other topics as well. But we will start with COVID. Let's see, let me get some COVID data. So yeah, I don't know how it's feeling out there to you. I feel like we do just continue to see high case rates of COVID. This is our state map, and again, orange is places where there've been where there's high case rates, as well as hospitalizations. Yellow's medium, and green is doing better. This is another way of looking at our state map, community transmission, and this is just about case rates. So as you can see, really across the state, we have high case rates and high percent positivity. Looking at the, this is basically the weekly new reported cases. And one of the things that's kind of interesting here, a couple weeks ago, I think it was about 2 weeks ago, it looked like the cases were going down. And this was kind of our BA 2.12.1 wave. And then, when we thought things were sort of settling down from that, right on the heels of that, we've had the next variant, which is BA5. And so it's kind of given us more of a, we didn't come all the way down before the next variant. We're still up there at fairly high case rates. This is a look at the variant tracker. And so you can see that really across the US, BA5 has been the best competitor. It is the majority of cases in most places. And that happened very, very quickly. Okay, so moving on to vaccine, we are seeing, we do have vaccine for COVID available for the youngest children, 6 months and up, but we are seeing not a lot of uptake among parents for their youngest kids. And so in a survey of parents of children under 5, and this is the Kaiser Family Foundation, 17% of parents said that they vaccinated their child or will get them vaccinated right away, so plans to do so. But then 43% said they would not vaccinate their child no matter what. And that's a higher percentage than we saw in other age groups. In other age groups, it was sort of 30% that said they would not vaccinate their child. And then 40% said they would wait and see or only vaccinate if required. And I think for this group, I mean, it's, busy parents, it takes a lot of time to make a doctor appointment and go in and get vaccinated. Kids are getting a lot of vaccines at that time. But I think this 40% is really where you guys come in being able to communicate the importance of vaccine, and where doctors and nurses, the trusted medical voices, the whole team can help influence this group to go ahead and get their kids vaccinated. So for continuing on with the numbers, 53% of parents say the vaccine is more risky for their child than getting COVID. And that really isn't true. There's no evidence of that. The vaccine has been proven to be very safe, especially in these youngest kids, not seeing the myocarditis risk. And COVID really can be can be mild, but it can be very serious for children and have lasting effects. 81% are worried about serious side effects from the vaccine and say there's not enough known about the side effects. And again, to that, I would say, tens of thousands of children have been vaccinated with this vaccine. And overall, they've weathered the side effects better than the adults. I think back to the very beginning of vaccinating adults for COVID, and people were basically like trying to get vaccinated on a Friday so they could take the weekend off because they were worried about the side effects, and lots of people had pretty bad side effects. Overall, kids are weathering this pretty well. 45% of Hispanic or Latino parents are concerned about not getting their kids vaccinated at a place they trust. And so, and I think this was also predictable, like, I don't know, as an adult kind of going through a drive-through and you don't really know who's vaccinating you, but you kind of just take it on faith. If it goes into that upper deltoid there, they're doing a good job. But you maybe want a little more hand holding when you're taking your baby in to get vaccinated. So, back to the, like, how do children and how do they do with COVID? And again, lots of them have done just fine. But there is a potential for long-term effects from COVID, and there is more attention being paid to long COVID in children. So, some of the symptoms that can last for longer than you would expect: tiredness or fatigue, headaches, trouble sleeping, trouble concentrating, muscle or joint pain, and cough. And then, of course, we know that there are some really, terrible consequences of COVID, like getting hospitalized, being in the ICU, and even death. So compared to long COVID, vaccine side effects only last a few days if kids have them at all. So, pain in the arm, we all know about that. The swollen lymph nodes sometimes happen. Irritability or crying, sleepiness, loss of appetite, fever, headache, muscle or joint pain, and chills. So all of them are possibilities. It is okay to give your child a little bit of Tylenol to deal with any kind of post-vaccine issues. So an update on Omicron booster shots. So this is kind of the big new thing coming down the pike. Maybe as early as September, although we are just a month away from early September, and it doesn't seem like we're probably going to be on that time frame, but you never know. So I'm thinking it's going to be more like October. But the Pfizer and Moderna are producing bivalent booster vaccines. So basically, it's going to be a combination of Omicron and the regular old COVID in a combo shot. And these booster shots will need to be given FDA approval, and the CDC will need to give their recommendations. So kind of the same process we've seen before for getting new vaccines authorized. The big question that comes from that is booster shot now or later. So if you're someone who's over 50 or someone who is immune compromised and you just haven't gone and gotten that second booster yet, should you wait or should you not? And it is a tough question. I was actually on a call with some people from the CDC talking about this very thing. And their recommendation was, if you're in a place with pretty high community transmission, so high BA5 rates, which we saw that red across the state map, that their recommendation really would be to go ahead and get that booster shot now, because even though it's not Omicron specific, it's still going to boost your antibody levels and decrease the chance that you catch COVID. And even if it doesn't completely prevent COVID, it's also going to keep you from having bad effects from COVID. So that was their recommendation. And then when the bivalent booster comes, you could get that, although there probably will be something like a 4 or 5 month wait, 3 to 5 months, I don't know, between your last shot and the bivalent booster. But again, we don't have an exact time frame for that new booster coming. But if you're under 50, and not at as high risk, then you may, you're not eligible for the second booster anyway, but you may want to wait and just get this booster when it's available. So yeah, if you're able to get a second booster, we encourage you to get it now. And you'll still be able to get that Omicron booster. I say get it now, so that the time starts ticking before that next booster comes. So here are some of the questions we got asked last time, and thank you to Liesl for doing some research on this and putting together slides. But where do these diseases come from? So COVID-19, this is definitely an issue that has been debated quite a lot from the beginning of COVID-19, with lots of conspiracy theories and You know, I think still getting looked at, but I would say the overall consensus is that COVID-19 might have originally been spread to animals, from animals to humans at a market in China. There's lots of concerns about kind of bioterrorism for this, but I don't think any of those claims have been proven. And where did monkeypox come from? So monkeypox is interesting. It was first identified in some monkeys that lived in a lab in Copenhagen, Denmark in 1958, with the first human case recorded in 1970 in the Democratic Republic of the Congo, which was called Zaire at that time. So monkeypox has become endemic, so just kind of part of the usual diseases in some African countries, and has kind of waxed and waned a little. So there'll be little outbreaks, and then it'll calm down. In 2003, there was a monkeypox outbreak here in the United States, and that was actually the first recorded case outside of Africa. And it was basically transmitted to humans by infected prairie dogs. So I did not know this until I was reading about this outbreak, that there is such a thing as a pet prairie dog, but apparently there is. And these pet prairie dogs were in a cage close to some small rodents that were imported from Africa. And through some shared bedding, or, you know, I guess that was the going theory, the prairie dogs got infected. And then when they went to their owners and, you know, bit their owners or scratched their owners, then the owners got monkeypox. So there's about 47 cases across 6 states in the US. And at that time, there was no human-to-human transmission that got recorded at that time. Since then, the FDA has put some, FDA, I think it is the FDA that put some restrictions on importing small rodents from Africa. So why did diseases spread from animals to humans? And, you know, I think there's lots of reasons, but events like climate change, food production, destruction of natural habitats, increased trade and travel, bringing humans in closer contact with wild animals. And I think also some of this, like, you know, having more unusual pets can do it as well. And then, so this has contributed to more diseases spreading from animals to humans. And then we know that all the travel that humans are doing now helps those diseases to spread. So monkeypox. In the US, there have been 6,326 reported cases of monkeypox in the United States, and 10, I think now 11 cases reported in New Mexico. It's still overall a pretty rare disease, again, compared to COVID. But it is, you know, worth paying attention to, because we haven't seen monkeypox spread in the, you know, outside of Africa like this. So there is some thought that maybe there was a little mutation in the virus that made it a little bit easier to transmit person to person. And probably this spread has slowly been happening since an outbreak in Nigeria in about 2019. So it's not a like complete surprise, but it's certainly in higher numbers than it's ever been seen before. So monkeypox and pets, we had a question about this last time, and basically the recommendation, I mean, there's a lot that isn't known. So the recommendation is people with monkeypox should avoid contact with their pets, because there is some thought that the pets might be able to get it. So pets who have close contact with someone who has monkeypox should be kept away from other animals and people for 21 days. So they have to do their isolation just like we do. And then when possible, friends or family members who do not have monkeypox should take care of the animal. And that's really, you know, kind of an abundance of caution, because one of the things in this outbreak is trying to prevent monkeypox from getting into the animal population, because then that's a reservoir that can kind of come back to the human population. So you kind of want to keep it out of animals in the United States. So animals that we know can get monkeypox are prairie dogs, as we learned in the 2003 outbreak, squirrels, marmots and groundhogs, chinchillas, giant pouch rats, hedgehogs and shrews, and monkeys and apes. It probably is the smaller rodents, which is kind of the reservoir of disease, more than monkeys and apes. There's a possibility that some rats, mice, and domestic rabbits may also be able to get smallpox. So in Africa, where they find monkeypox is in the small rodents there. So monkeypox in other animals, it's unknown if many farm animals, pets, and wildlife can get monkeypox. However, in the US, it is extremely unlikely for animals that have not been recently imported to have monkeypox. And that's partly our first case of monkeypox here in the United States was May 17th. So we haven't been dealing with monkeypox very long. And there's no thought that at this point it's in the animal population. Cows do have their own pox virus called cowpox, but that's a different virus. So can monkeypox be spread through a blood transfusion? And we looked into this. Monkeypox is not known to be spreadable through blood transfusion. And this is from looking on websites from places that track, what am I trying to say? The websites that do blood donation. There have been no reports of a person getting monkeypox through a blood transfusion at this time. There's actually a lot of restrictions if you go to the United Blood Service website and look at who can and cannot donate blood. There's a fair number of restrictions that in general prevent kind of these acute illnesses from getting into the blood supply. So does the smallpox vaccine protect against monkeypox? And this question is really about the smallpox vaccine that some people got as children. And again, in the United States, it was around 1972 that it stopped being given as a routine vaccine. But because monkeypox is closely related to smallpox, the two viruses are related, the smallpox vaccine can protect people from getting monkeypox. So it is thought that people who got that smallpox vaccine probably do have some better immunity against monkeypox. Getting vaccinated after a monkeypox exposure might also help prevent someone from developing monkeypox or make the sickness less severe. So this is the vaccine that's currently being distributed in the United States. It's called JYNNEOS, and it's a relatively new smallpox and monkeypox vaccine, not like the one that some of us that are old enough got as children. This one is a sub-Q shot, so it just goes back in the back of the arm. It's a 2-dose series, and it has none of that kind of blistering, scabbing situation that, that happened with the old smallpox vaccine. That one is still around, but hoping that we don't have to use it in this outbreak. So does everyone need to be vaccinated for monkeypox? Definitely not. Not everyone needs to be vaccinated for monkeypox at this time, because it really is a specific population that it is that it's spreading between, and that is so we're trying to target the highest risk people because there aren't a lot of doses of vaccine. So those people are people who have been exposed to monkeypox. Like if you have a sex partner that calls you and says, I had I just got tested and I have monkeypox, that person should come in, not the person with monkeypox, but the contact should come in and get vaccinated. And anyone working in a lab with monkeypox or smallpox viruses should also get vaccinated. And that's a very small number of people here in the state. The CDC at this time is not recommending that healthcare providers providing routine care get vaccinated for smallpox, even though most of us probably will encounter a patient that has it. And the recommendation if you're testing patients for monkeypox is full PPE. So if you think you're at risk for monkeypox and are interested in a vaccine, call the New Mexico Department of Health. And this is that old COVID hotline, and it's still a COVID hotline, but now it answers monkeypox questions too, or the nurses answer monkeypox questions, and they will register people for vaccine. So that number is 855-600-3453. Option 4 is a new option, but that will kind of speed the process of getting you to someone to the monkeypox side of the call center. And they will run people through a risk, a series of questions to determine their risk. The highest risk people will end up getting invited for vaccine. The lower risk people will stay on the list, and if we suddenly get more vaccine, then those people will be invited. All right, the monkeypox toolkit. This is the website, the New Mexico Department of Health monkeypox website. There is a toolkit that has a lot about messaging. It also has some fact sheets and posters and flyers. It has the call center information about registering for vaccine as well. All right, what about African swine fever? This one is highly spreadable and deadly disease that can affect pigs, but African swine fever has never been found in the US and doesn't affect people. So we're good on that one. And then thank you everyone for all that you do. Liesl, I love this, this mural. It's beautiful. Thanks for finding it. All right, I'm going to stop sharing.
Does NMDOH track vaccinations with children in CYFD custody?
So I don't know if CYFD separately tracks, but that would be the tracking that New Mexico Department of Health does is through the NMSIS system. So we really hope that every provider who provides a vaccine enters that vaccine into the NMSIS system so that, you know, anywhere you go as a child, the provider can pull up and see what vaccines you've been given. And I have to say, one of the good things about COVID is that it was required to put COVID vaccines into the NMSIS system. And I think it did help a lot of providers kind of get more familiar and use it more. So I'm not exactly sure if CYFD is keeping separate track.
Okay, your next question is, it's asking about the fall booster, I believe, and it says, this is a different vaccine separate from the regular COVID vaccine. Does this vaccine target Omicron variant only? And are the Omicron booster ingredients different?
So all good questions. It really is going to be the same. I would put it in the same category. So it's the mRNA vaccines that are working on these boosters, although I think Novavax might be also, but the ones that we've heard about is Pfizer and Moderna, basically taking kind of the same structure of their vaccine and just adding a little more information about, so your body can fight off Omicron. So it's kind of the old one blended with a little bit of Omicron information. So it really isn't very different. Will it have new side effects? You know, I don't really expect that it will. I think it'll perform very, very much the same. And was there another part of that question I missed?
I think does it target Omicron only? Did you answer that?
So it is going to, at least, and you know, we don't really have a super, like, I mean, all of this is kind of in development. So I would say at least what we know right now is that the plan is still to do a blended vaccine. So the old, they call it the ancestral Omicron, sort of the original Omicron that they built those vaccines off of, mixed with some Omicron specific information, I guess, for your body to respond to. So it'll be kind of a two-part, it'll be blended in one. And what I can say is it's a lot like flu. Like every year they're like, we're going to do a little H1N1 mixed with a little bit of, influenza B and influenza A, and we're going to mix it together. And this is what this winter's flu shot is going to look like. So it's kind of that same model. We're taking a little bit of Omicron, a little bit of the original one, and it's going to be a booster shot.
Great. Next question. Is there more information on Novavax and when it will be available in New Mexico?
Oh, good question. It is available in New Mexico, but there isn't a huge supply. I actually had a list, and I can send it to Liesel, of places that have Novavax. Like I think Presbyterian ordered some. Anyway, I can get a list. So there are a few providers that are providing Novavax, and I think a lot of providers probably won't get Novavax just because overall the demand is still low. But I think if you know where it's available, you can send your patients that direction.
That was my question, but I have to ask, is anyone in the UNM system, because a lot of these insurance companies, although they're supposed to give a lot of flack to Medicaid patients who you send depressed, who are UNM patients or loveless patients. So the UNM system be getting any?
I don't remember UNM being on the list. And it also was our preliminary list. So, I mean, it's sort of it is a good point, and maybe, maybe worth reaching out to UNM to kind of see if they'd be at all interested in having it at least in some of their offices.
Thank you.
I'm gonna write that down. Okay.
Okay. Next question is, how would domestic animals contract monkeypox? What are signs and symptoms and contagion path?
So I think the main way that they would contract monkeypox from a human would be kind of like that, face to face. So our saliva, if we're infected with monkeypox, human saliva does carry monkeypox. So it would be that kind of like really close contact. I still think it's pretty unlikely, but again, and you probably remember at the beginning of COVID too, people were like, stay away from your pets. You never know, they might be able to get it. I think over time, people have probably relaxed on that a little bit. So anyway, that's how a dog or a cat would get it. And then I'm not actually sure if, I don't know what it would look like in a dog or a cat. I would imagine just kind of that general like malaise, maybe not eating as well. And I don't know if they develop pox. We do have I just discovered that we have a veterinarian that works with the Department of Health. So I will ask him that question. And shoot, was there another part of that question?
It said contagion path.
Yeah, so I think that would be the main, so respiratory droplets would
Yeah.
probably be the way that it would pass.
My primary concern is that I have or deal with a lot of people who have different, how do I put this? They're on the spectrum for autism. So they have emotional support animals, and they have animals that are service animals, and they're not always dogs and cats. They're also, I actually have one that has a pig and one that has a rabbit. And so the concern is, how would that pass from the animal to the human, but also how would the animal get that if they're not exposed? Is it like COVID, where it can be like they went to the vet, or they had something that they had to get at the vet, and so they got it through the air, through droplets, or is it some other path? And is there distemper to look out for because they don't feel well, or something that you can see other than pox? Because I doubt you could see that under the fur.
Yeah, I'm kind of guessing you wouldn't be able to see it under the fur, but so I would say I really wouldn't worry in the US about like domesticated animals to human transmission. And even to anyone's knowledge, it's not in the wildlife in our country. And I think that's part of what everyone's hoping to prevent, that happening. So I really wouldn't worry about like anyone who has a cat and a dog. And if you don't have monkeypox, like you're a safe little pair. And again, there's only 11 cases in the state. Everyone got it outside the state, and came home and have been isolating. So knock wood. It's for people, the idea of people giving it to their pets. I think also, probably masking, if you have an emotional support in all these things, there's always that risk benefit balance. And so, if that emotional pet is really important to kind of your daily survival, what I would recommend is, kind of wearing a mask. If you have monkeypox on your hands, that's kind of like, you probably don't want to do a lot of petting of that animal. You don't want to pet the animal unless you've got gloves on, at least until we know more. I mean, maybe in 6 months, people will be like, oh, don't worry about the pets. But for now, because people don't know, it's kind of a better be safe than sorry. But it really spreads through either respiratory droplets or direct contact with the pox. And so we wouldn't expect a pet to pick it up at a vet, just because there are no pets that have it right now. Does that make sense?
Yes, ma'am. Thank
Okay.
you very much.
Thank you. And I would just encourage anyone, if you need more clarification, feel free to interrupt us. We are totally fine with that. We want to make sure that you guys have everything that you want answered. So the next question is, people have been asking if they've had monkeypox, if they've had chickenpox, can they get monkeypox?
So the answer to that is yes. They actually sound like related viruses, but they're not actually related viruses. So unfortunately, vaccination to chickenpox or having had chickenpox doesn't protect you from monkeypox.
Another question is, can you tell us more about COVID medication and reactions to the medication?
So I'm guessing this is mostly talking about Paxlovid, the one that the president took, the oral medication. And overall, it's pretty well tolerated while people are taking it. The issue we do keep hearing about is the rebound. So you get COVID, you take the medication, you feel better, even test negative, and then a few days later, maybe get some symptoms back and even test positive again. I did also hear from CDC sort of an interesting take on that, which is, again, like the purpose of Paxlovid is really to prevent hospitalization and death. And it did that in the studies and in kind of post-marketing studies, about 85% effective. So it's really an effective medication, but it never promised to take away all your symptoms forever. So it's a kind of a drag, the rebound. And I guess I'm kind of guessing that studies are in the works for maybe it's better to leave people on it for 7 days or 8 days. But for right now, what we've got is a 5-day course. And it still is, even though there's that chance of rebound, people are not landing in the hospital with the rebound. It's just, you might have to stay home from work a couple more days. Does that answer that question?
This is Debbie Ortiz from Torrance County. Yes, we have a coworker that did contract COVID. She got on Paxlovid and had a horrible allergic reaction to where she had like hives. So I was wondering if that was normal, and if is there an alternative to taking Paxlovid, or is that what they're recommending most?
So it is, so it's fairly unusual, but literally every medicine, like, yeah, someone's going to be allergic to it, unfortunately. So, and there are alternatives. So if someone starts on Paxlovid and, that allergic reaction is fairly immediate, they should stop it. And then the other options, there's another oral medication called molnupiravir, which is not as effective, but still protective. And then there is still the IV monoclonal antibody, bebtelovimab. It's not in very high supply, but Presbyterian here in Albuquerque does run some of, I mean, they basically use whatever they can get. That's a one-time infusion. And then there is also a 3-day infusion, remdesivir, and Presbyterian's giving that as well. And that's also very effective. It's definitely a drag to have to go 3 days in a row for an IV infusion. And obviously sort of takes a lot of, like, it's much more efficient if we had more of the bebtelovimab, the monoclonal antibody that was just a one-time infusion, but we don't. So there are other options for sure.
Thank you.
Yeah.
Thanks, Debbie. The next question is, has there been any deaths from monkeypox?
So in the US, in this current outbreak, there have been no deaths from monkeypox. There have been a few hospitalizations, mostly for pain control, because some of the lesions, when they're in sensitive areas like around the mouth, around the genitals, or around the anus, can be very, very painful. In the whole world of monkeypox, there definitely have been deaths, and there's actually 2 strains of monkeypox, kind of one that in Africa causes between, it sounds like 1% to 3% of people who get it die from it. We fortunately have the other strain happening, and that seems to be an under 1% death rate. So it is possible, but has not happened in the United States. And I think you're starting to see other countries reporting. I think India reported their first monkeypox death. I think Spain has, anyway, that they're popping up, but not very frequent.
The next question is, well, it's more like a paragraph. I'll read it. It says, "This is a concern I got from someone we talked to last week. This man was scheduled for his 4th vaccine, and his clinic told him that after he got vaccinated, which scared him because there was so much precaution this time compared to the other times he got vaccinated that were quick and did not require that. He wanted to know why it required 1 hour this time."
I don't know the answer to that unless someone just kind of said the wrong thing, but it hasn't changed from the very beginning of COVID, which is most people, it's recommended to have a 15-minute observation. And then people who've had, major allergic reactions to other injectable medications need 30 minutes of observation. I'd say at this point in my experience being out giving vaccine, that most people by the 4th shot aren't actually sticking around the 15 minutes, and that's probably okay. I mean, I think the most important is that first vaccine when you don't really know how it's going to affect you. But I have to say, really, we enforced it quite a bit with COVID, but every vaccine, if you actually read their package insert, recommends a 15 minutes of observation. So, but, again, for flu and stuff, you kind of get it and leave. So I don't know about the hour. That is very unusual.
Here we have another paragraph. It says, "Originally, I remember hearing that monkeypox was spread by direct contact, like an STI. Is it now considered a higher contagion level now that it is known to be spread through respiratory droplets? People are starting to get more concerned. Is our message still that it is unlikely to contract unless you have direct contact with someone who has visible pox?"
So I think all along, and including like in the original, like in Africa, it's always had sort of both possibilities for transmission. So definitely the number one way that we're seeing it spread is close skin to skin contact with other people who have the lesions. It's still kind of out there as a possibility, which is why healthcare providers have to wear PPE, you know, masking on, well, at first CDC said mask on airplanes, and then they kind of retracted that. But what CDC says about that whole idea of respiratory contact is if you've been unmasked, if you've been within 6 feet of someone with monkeypox, unmasked for 3 hours, that's kind of would put you at risk. So that's so different than COVID. You know, COVID's like unmasked within 6 feet, or even wearing masks within 6 feet for 15 minutes. So just if that sort of helps, like it really doesn't seem like what we're seeing in this outbreak is people, like, no healthcare providers have gotten it. We know that, you know, people have walked into rooms. I mean, hopefully they're wearing masks, but you know, they've been in rooms with people with monkeypox before they realized it was monkeypox. So no healthcare providers, you know, I think in the US there actually haven't been any children, or maybe 1 or 2 out of 6,000. I mean, we're just not seeing it spread in that kind of like casual contact with other people. So again, it's a precaution. You should mask if you've got monkeypox. You should be careful if you're visiting some, you know, they should be isolating. You shouldn't be visiting them. But really the major contributor to this outbreak is skin to skin contact with someone with monkeypox. Does that answer the question?
She said yes, thank you. Do you want to go ahead and ask your question?
Yo.
Sí, sí, sí.
Tengo una pregunta. Hablé con una persona, entonces él me dijo que al siguiente día de que se puso la vacuna, se le empezó a dormir el brazo y parte del brazo y parte de lo que abarca el brazo. Y al tercer día, pues él empezó a vomitar sangre y tuvo que ir al hospital. Entonces le dijeron que estaba muy deshidratado. A la semana lo entubaron y dice que estuvo una semana entubado porque no podía respirar. Entonces yo tenía entendido que los efectos de la vacuna son de poquito tiempo, de que se pone la vacuna a 15 minutos. Entonces quería saber si esto era posible que fuera un efecto secundario de la vacuna.
Sí, de vacuna de COVID, ¿sí?
Sí, del COVID, correcto.
So the question is that she knows someone who had gotten the vaccine, and then the day after they got the vaccine, they were feeling pain on the arm. And then the third day after the vaccine, they started vomiting blood and had to go to the hospital. And they were also having respiratory problems, breathing. And these are side effects, but that didn't happen in the 15 minutes after they got the vaccine. They were fine, but there were side effects that developed in the days following. So it was a question about that. Sí, le estás preguntando sobre como los efectos después de como 12 días después de la vacuna, si está normal o por qué existe o.
Sí, correcto. Ajá, que si en el hospital yo le pregunté al paciente qué diagnóstico te dijeron y me dijo, oh, no sé, no me dijeron nada. So, no sé si no lo quiso compartir o no sé porque él estaba bien molesto por la reacción esa que tuvo de la vacuna porque estuvo 1 mes entubado en el hospital.
Yeah, so she also said that it was after the vaccine and he was just very frustrated because he ended up spending so much time, like up to 1 month in the hospital after the vaccine and after these symptoms developed.
Yeah, I think on the question of the 15 minutes, that is really just looking for anaphylaxis, that immediate allergic reaction that can swell up your airway and you need, you know, epinephrine treatment. But it is true that that's not, I mean, that's very rare. So we observe people for 15 minutes and assume that, you know, it hasn't happened in 15 minutes, it's unlikely to happen, and let them go. But that doesn't mean that there aren't other, like you're saying, that it can happen, that other side effects happen. I mean, that one also sounds, you know, if the medical team determined that that was what happened with, or that that was due to vaccine, it that is a very serious side effect, and, you know, should get reported. And I would recommend that person not get that same vaccine again. But again, very, very unusual, but not unusual that it happened, you know, within a day or two. With those, I always wonder though, you know, is it possible something else was going on at the same time? Because sometimes weird coincidences happen. So good that he got full medical attention to try to get that figured out. Does that answer the question?
Inclusive yo le dije que si podía agarrar su número para preguntar yo en estas juntas que tenemos, o para ver si él lo quería reportar a algún sitio donde se reportan los efectos secundarios de la vacuna. Y estaba muy molesto y dijo que no quería saber nada de las vacunas.
¿Y puedes repetirlo? Estaba como mi conexión estaba falta un poco.
Sí, yo le pregunté que si quería darme su número de teléfono para yo tenerle una respuesta, y que si él lo quería reportar al donde se reportan los efectos secundarios de las vacunas. Y el señor estaba muy molesto, dijo que no quería saber nada, absolutamente nada de las vacunas.
Sí, sí, entiendo. So just to translate, she was talking about how she offered to the person to kind of take his number and get back to him with information about more side effects, or to learn about why this is happening. But he was very upset and really bothered by what was going on, and said that he doesn't really want to know anything else about the vaccine.
Yeah. And I think another good resource, if he gets to a point where he wants to think about it a little bit more, you can always refer him to the call center, because there are nurses there that can start the conversation, and then if it needs to get escalated, they track us down to get back to people. I apologize. I have a 1 o'clock meeting that I need to go to, so we can do another question, but I will have to hop off at 1.
Okay, let's have Rosalba be the last question.
I'm sorry. No, yo lo que quería agregar es que, que una de las cosas que nosotros como promotoras tenemos que tener en cuenta es decirle a las personas que cada individuo es diferente, y que la reacción de la vacuna es nuestra respuesta de nuestro cuerpo hacia la vacuna. So, de veras no es culpa de la compañía, sí, es una respuesta inmunológica. Entonces eso no es culpa de veras de nadie más que de la reacción, que no es ni del señor, es del primo, es la reacción del cuerpo. Entonces eso tenemos que saber que puede ser en cualquier medicamento, las personas que son alérgicas a la penicilina o a la dexametasona. Estas cosas son unas en miles. Entonces no tenemos que también dar ese mensaje para cuando estas cosas sepan, que la gente sepa que esto puede pasar, ¿no? Do you want me to translate, or do you translate?
Would you like to translate?
Yeah, well, the
make
only
sure.
thing that I added is that when we are doing the messages about vaccines or any medication, is that it's not the manufacturers, it's not our fault. It's not even the person's fault. It's the fault. It's when you have a foreign object into our body, it's the immune response of our body. So that's something that we have to tell people, because he's very mad and, oh, like you hurt me and stuff like that. But that's not the intention. We just want to give a protection to the person. So that's something that when these cases happen, that we explained before, that in some instances it's the person's own immunological response that creates this. No.
Thank you so much, Rosalba. Or Miranda, I think you're on mute.
Thanks, everyone. I'll see you next time.